All right, man, we're going to be talking Costa Rica versus Mexico, medical dental tourism. Where should you go? But we're going to be talking about advantages, disadvantages of both places. We're going to be comparing the two because we're with our medical dental guru tourism guy, medical dental tourism guru guy. Johnny, yeah. All right, so we were talking to him all about it, and during this conversation, I think you're gonna. I don't want to wait to the end because it's gonna be such a surprise. Mm-hmm. So we'll throw it in there somewhere. Why you're so knowledgeable about Mexico. Right. We're gonna be talking in a minute, but first, I'm Michael Allen, TravelCostaRicaNow.com. TravelCostaRicaNow.com is a travel agency, so go to TravelCostaRicaNow.com. Fill out the 4-minute form. You'll be that much closer to the vacation of a lifetime. We're like you, having best friends who live in Costa Rica, who know Costa Rica, totally hooking up your Costa Rica vacation. Hey, YouTube doesn't care if you subscribe. Doesn't mean you're going to see our videos. You got to hit the notification. Please subscribe if you haven't already. But to see the videos as we put them up, you got to hit the notification bell. All right, first things first, Johnny's is our medical dental tourism guy. If you choose Costa Rica to do anything, liposuction, dental implants, breast augmentation, stem cell therapy, all of it, and you want help with that, go to TravelCostaRicaNow.com's website, scroll down, fill out a little medical dental tourism form. It's very quick. We shoot it to Johnny. We'll have your teeth fixed in weeks, days, right?
Depending on what it is.
Right. All right, so, people like to compare. That's what they do. What's better? Who's cheaper? Where's the quality? All that. And a lot of it is, in the medical dental tourism field, it's like a Costa Rica versus Mexico. You know what I mean?
Yeah, Mike, there's a lot of places around the world that do medical tourism. One of them close to the States is Mexico and Costa Rica.
Yeah, and we do obviously get a lot of, gringos, Canada, United States. So I guess the closeness kind of does matter. Proximity matters.
It does matter because a lot of times when you're doing things, the travel time between your country of origin to where you're going matters, especially when you're doing things that take time.
Right, so how do I want to do this? Let's first talk the advantages of doing your medical dental tourism in Costa Rica. Why do you think people choose it? Maybe like the top 3, 4, 5 reasons that people go, okay. Because again, there are other places. There is Mexico, but how's Costa Rica get on the map? Like, is it because they know there's good quality? What is it?
I think a lot of people choose Costa Rica. It's not always price. It's something that they're familiar with. They're comfortable with the culture, the treatment, and sometimes the closeness that they have to the country, the love that they have for the country, transfers over to what they feel is Costa Rica's great focus on healthcare.
On the internet, yes, but on the internet, does Costa Rica have a good reputation of a medical dental tourism destination? I think it does. But is it known,
It is known. This has been happening for the last 15, 18 years of medical tourism. The dental side has definitely evolved quite a bit. The medical is coming up on its heels. It's showing it can do things, accepting that this exists, and breaking ground. Because there's differences between doing dental and doing medical, because medical a lot of times involve a lot more preparation, more treatment, a lot more professionals.
Maybe recovery
time, a lot of things. It just depends on what you're doing. Dental requires time, but it's not so much as on the medical side. There's a lot of things to take, a lot of factors to take.
Yeah, but I think Costa Rica is getting a pretty good reputation of there may not be a lot of hospitals, but they're good hospitals. There may not be a million doctors, but there's a lot of really good doctors in their fields in these different fields.
In Costa Rica, yes, correct. But you have a lot of Costa Ricans that also do their fellowship in the U.S., so they understand the methods. They bring them over. They use a lot of the equipment from the U.S. that used to in the dental side. They use a lot of the implants that are used in the U.S.
A large percentage speak English.
Large speak English, and those that don't speak English, their assistants do speak English. So it's more of a setting that it's comfortable for both people.
I mean, you do with a lot of people that come down here. I mean, do they tell you? I'm just going to plug you. Don't try not to turn red, but I think a lot of people choose is because I mean they've seen so many videos about how good you personally take care of people that come down here, and you know I mean personally that's a pretty important variable because you know you're going to another country and you know a lot of people you know aren't comfortable navigating and you know that or maybe I don't know what it is, but a lot of people do like that whole off the plane, help me out, get me to my hotel, get me to my doctor, you know, stop at Walmart and, you know, buy me some shirts or something.
Well, you know, I appreciate it, Mike. By means, we do our best, and but we're not always perfect. Things happen at times, but we do our best to fulfill that stranger that's in the country, or sometimes they travel alone and they need somebody. And sometimes it's not included in the package, and we're there for them. But yes, you're right. A lot of times is our recommendation that they come here, and they feel that they can do things with us.
All right, we're going to get back to Costa Rica, but you know what? I don't want to wait to the end of this because if we wait till the end, some people might have already turned us off. Guys, we haven't really put this in a video. Johnny does all this stuff in Costa Rica with medical dental tourism in Mexico as well. All the same stuff. Vetted people, knows the doctor, knows the hospital, knows the areas, does the exact same, still provides a concierge type of service in Mexico. So don't think this is, we're trying to talk you into like, oh, you know, I don't know, Mexico's cheaper, you should go there. We don't care, we want what's best for you guys. I just know like, just with Costa Rica, me personally, I'd be thinking, well, I've always wanted to see Costa Rica. I'd want to go on a vacation down there. Right. So I probably would think about that, you know, that kind of stuff. But let's talk about Mexico because they've got tons of advantages as well.
Mike, I'm going to take a little bit about, people also have to understand when you're doing tourism or even cosmetic or dental, whatever area, whether you choose Costa Rica or Mexico, price has a cost. So don't always base your decisions on this person is less expensive. Base it on who you feel that is a right fit for you as a physician, but also too that they have a track record that, you know, we vet them very well. If you use our service, we vet them very well. But price, don't always harp on price because price has a cost. Sometimes doing a little bit less, you're going to get less. It's just,
well, it's interesting because it seems like it goes across the board and everything. I've been dealing with this ever since we started making videos. People go, well, I wouldn't live in Costa Rica, it's too expensive. I will go to X country. Okay, yes, I'm sure X country can be cheaper, and it can be. But you know what? There's other variables to consider, like maybe government or cultural things or all kinds of stuff. And if you're just basing something, I think how you just did, it's bigger than money's important, obviously.
Oh yeah, definitely.
I totally understand why people go, well, that's cheaper. I see that route, but there's so much more in play, especially when you are wanting to live somewhere else, or you're picking a doctor to do a serious, procedure.
Mike, it goes back to in the States, a lot of times, I don't know about you, but when I was in the States, I felt like when I went to go see a physician, I was going for an interview, if they would take me, if they were going to be my doctor for a while. It's that, and that's what you don't get, that's the difference you get in these other countries. But they're interviewing for you. They want you to be happy. They want you to have a good experience. It's a want to help you.
I'm assuming, since you work in both countries, that as far as quality doctors, quality hospitals or things like that, I'm assuming that they're probably comparable and about the same, right? Or no?
They're the same in the sense that quality doesn't change because of price. It's the cost of living in one country versus the other is different.
Right. So, I mean, we should just say it. I think a lot of people know this. Mexico is cheaper for medical dental tourism.
It is.
It is. So it can be closer. Obviously, if you live in Texas or whatever, it's closer. You were saying off camera, there's, comparatively speaking, I don't know, maybe Mexico started first, but they have like 73 million hospitals.
Yeah.
Did you say 73 million?
Not 73 million. They have a little bit over 300.
Well, that's a lot. I mean, and here we were talking but you only need one. I mean, technically.
You only need one.
You only need one. But, so quality doctors, quality services, quality equipment, all that kind of stuff, I'm assuming it's pretty comparable that way.
It's above board most of the times. It just depends on which state you choose inside Mexico. Sometimes they have specialties, like certain border towns. A lot of their specialties, focused on dental side. When you go farther in, when you go to Acapulco or you go Cabo San Lucas or some areas like that, sometimes their specialties are plastic surgery. It depends on what state it is and what they offer, how many professionals are there.
Do people ever, so if cost is cheaper, and it sounds like it's fairly cheaper, well, you kind of said that a lot of people don't pick Mexico because they think it may not be the safest place to go to do their medical dental tourism. Is that a false narrative, or is there some truth to that?
There's a lot of truth to that. There's a lot of misconception is that anywhere in the world, there's places that are unsafe. There's areas that you shouldn't go, even in the U.S., that you should stay away from because it's the ghetto or however you want to call things. Same thing in Mexico or even Costa Rica. There's areas you shouldn't go.
Right.
And as long as you steer free from those areas, you shouldn't have any issues. I will tell you from a lot of patients that I've taken to both countries, nothing has ever happened, knock on wood.
Right.
But of course, if you put yourself in a situation to go out and wandering and asking for illicit things, you can find illicit trouble.
Yeah, play at your own risk.
Play at your own risk. But we've had a lot of patients go into Mexico and no issues. So it's not the media bases, the cartels and the hangings and all these things. But everybody is a people now. What we found, especially with in tourism, they take care of you. They really go that much further to make sure.
And
that
it's not like you're going to take them down a back alley to a back alley doctor where you know.
Well, Mike, I think you know me. A lot of times stuff may not be the most inexpensive, but for me, it's a person's safety, their safety in getting something done. If somebody wants to use a ladder doctor that maybe charge a little bit, but I'm not comfortable being safe, I won't recommend them. It's not economics, it's safety.
It almost sounds like the difference between picking Mexico versus Costa Rica, or I guess maybe anywhere, is just like if you're looking to save money, you don't want to do anything else, and you're just like, I'm looking for the most cheap, effective, good quality doctors, good quality hospital to get this thing done, then it sounds like Mexico is probably the place to go for you. If you're, okay, for instance, maybe you've been to Mexico 73 times and you've never been to Costa Rica and you know how beautiful it is down here, and you want to maybe mix a vacation with getting something done.
Right.
And, so maybe Costa Rica's a choice, although you might be paying a little bit more for services. So, I don't know.
Well, Mike, think about this. A lot of times your mattress at home that you use every day, sometimes we penny pinch on getting the best mattress, but we spend 6 to 8 hours on that mattress. Why shouldn't you get the best, decent mattress, something you're going to spend so much time with? Why shouldn't you spend your hard-earned money on the best treatment you can for yourself?
It is your health.
It is your health. The treatment is based on you, on what the outcome for you, the best way, and spend on yourself. We spend on other things we don't need. Spend it on yourself, so that hard-earned money that you spent saving all your life, it's spent well, but it's on you.
Yeah. Geez. I also want to say this because I don't want people to think we, almost kind of pulling a fast one. You've been working in Mexico for as long as you've been.
Same time, same period.
We just didn't mention it.
No, we didn't. But Mike, this is what happens. A lot of people ask, let's compare the two. And then a lot of people base their things on price. I am going to be transparent all the time. Mexico is cheaper. The quality is
Top notch.
Top notch. It's just as good, and sometimes in certain areas better than here. But it's a person's choice. I'm not going to push one country or another. I want you to be comfortable with your decision, but also too that when your decision's made, that it was a safe one.
I don't know. I just think this proves that Travel Costa Rica Now and Johnny want what's best for you, or we wouldn't even have this discussion because it's, I'm supposed to be Costa Rica. Everything's Costa Rica. Come to Costa Rica. Get your breast augmentation in Costa Rica. But I'm telling you, there's other options that might fit your needs a little better, and they might be in Mexico, right?
It could be. It's for us. It's more being transparent about things and knowing there's an option, but at the same time, you got to be right with that.
I think we got to be also, we talk prices and stuff, but if we're gonna be above board on everything, we like to say that Costa Rica is about a third of the price of the United States in general.
In most cases,
on
yes.
Services. So, what is what's the savings, Mexico versus Costa Rica on it, just a general way?
Well, Mike, pricing in Mexico, there's a lot of differences. It depends on what state you're going to, where you're going to get your treatment at. And I'm going to give you an example. If you're going in the border towns, there's certain focuses that they focus on, maybe dental in certain areas of plastic surgery. But there's other areas in Mexico that do the same thing, but they're farther north. And these towns, their pricings are sometimes even less than. But now there's certain states inside Mexico, the bigger states like Guadalajara and Mexico City, where there's a higher concentration of physicians, and sometimes the prices are different. So pricing inside Mexico is understand that being at 32 states, and 12 of those states have hospitals and tourism in, their prices do differ.
Now, would the city be more apt to be cheaper or more expensive? Just
it depends how far up north you are or how far down south you are.
all right. So if you go, like, for instance, Acapulco, I mean, that's a tourist town. Is that already make it a little bit more expensive?
Sometimes, yes. Depends on clinics that you're visiting, but yes.
All right.
Sometimes the more touristy towns, they tend to have a little bit more of a bigger push. When you get away from the touristy areas, you have a better chance of getting a better price.
So what is it about? In general, what's the kind of the percentage versus Costa Rica's prices? So if something was $10,000 here in Costa Rica, generally, I mean, I know there's so many variables. I get it, but
Give or take, if something's $10,000 here, you can look to have about $7,000 or $8,000 in Mexico. Also, on the lines when we're talking about pricing, there's also convenience that we failed to mention yet. I'll give you an example in border town like Tijuana or Otay, which is in California. There's special. There's 3 speed lines, medical tourism lines, that you can go to see a physician in Mexico, Tijuana. See the physician at 3 o'clock. The physician's there with you 30 minutes, 40 minutes. You've been back in line to get crossover, which everybody else is taking 2 to 4 hours to cross. You can cross in less than 15 minutes because they gave you a special consult that you came for a medical purpose, and that gets you across the border. Something that I wish Costa Rica, when you come visit, that you're able to skip the line through immigration and get through the system. But I'm going to give you a tip on even doing that here. Get into a wheelchair. The wheelchair gets you right through past that line, and you know what? Sometimes we need it when we get older.
how long's Mexico been in this? It sounds like Have they been big just because they have the sheer numbers of hospitals and stuff, or have they understood this, I don't want to say game, but understood this medical dental thing a long time ago?
It's been a long time ago. It's the proximity to the U.S. that's always been the factor. Mexico, in its minimal numbers, takes in about 1.5 million Americans that go over regularly, documented, that go over there to get services in Mexico.
You know, there's good. Well, I don't want to reinforce any stereotypes, but is there any disadvantages to picking Mexico? Is there any doctor scamming?
Yes, there is.
You know what I mean?
There is, but that's in any country, Mike. We got to be safe.
Okay, but I'm just saying, is there any other disadvantages people should be on the lookout for? I guess for picking any doctor wherever it is, but I mean, is there anything that you can think of that?
There's some shoddy places that I've had run into.
Like rental. Okay, you know how the rental car business here. There's just some scammy ones. When you come in to pick your car, the price isn't the price. I'm not necessarily talking about like a totally bad doctor, but are there bad faith players? You know, ones that are taking advantage of like the gringo dollar.
Yes, they are. There's quite a few, and you have to watch out for it. And one of the reasons why we have what we do is that we can give you that confidence that you're not going to be taken advantage of. And a lot of times we get taken advantage of too, Mike. It's not, and we do our due diligence. Just recently, it's happened to me in both countries that a hospital is charged more money for a procedure. And my word is that this is the price. It doesn't move from there. And the physicians know that. So a lot of times I've been in my word with the doctors and the hospitals, we're not paying another dime because that's what we said. But it happens. So
right. So I guess you'd be more apt to get taken advantage of if you don't really know what you're getting into, or you don't really have like someone like you helping, because I'm sure there's scammy doctors here taking advantage of gringos too, but you don't use those doctors, I'm assuming.
You try not to, and it happens at times. They get comfortable. Johnny has a trust from a lot of patients, and he's going to keep on sending patients. That's not the case. My thing is with the patient first, and the doctor second. We have to always. We're a patient advocate company. We have to put the patient first, and a lot of times the patient is who we're working for. We're not working for the doctor. We're making sure that the doctor can perform what they can do, they do what they say, and the price is a fair price. But the most thing is the safety and making sure that the patient is taken care of.
So to really kind of outline it, sounds like to me, I mean, just from a lay standpoint, you can get a great doctor in both places. You can be in a great, all that's going to be good in both places.
Yep.
And it really is going to come down to what your individual needs and wants are. And you're going to go, okay, now if it's straight out and out, I want cheap, quality, whatever, you're going to pick Mexico.
Yeah.
Right?
Some people will, and some people will still pick the least expensive here in Costa Rica. Just, it's more based on. We'll talk about an advantage or disadvantage. Sometimes here in Costa Rica, you have certain places that are a wealth of services. Sometimes closer to the beach, you don't have it. This is not the case in Mexico. Mexico sometimes is the opposite. Near the beaches, they have a lot of facilities that can take care of you if you want to be by the beach. But sometimes it's not good to be doing a plastic surgery treatment near the beach because you're going to be tempted to go out to the beach.
Yeah, you probably shouldn't go out to the beach.
You go before your treatment because what happens?
That's a whole nother video about how patients tend not to listen to what they should be doing for their best recovery.
Oh yeah, definitely. But we can only advise them, and it's their responsibility to try to follow what we say.
All right, guys, videos like these always kind of create more questions than answers, but I think that was a pretty good overview. If you do your homework and research when you're thinking about doing some sort of medical dental thing, you probably already know some of these things. But anyway, man, you want to come to Costa Rica? Johnny can help you. Want to go to Mexico? Johnny can help you. It's the exact same. I asked him, I wanted to make sure, off camera, I asked him before we started this video, do you do the exact same thing in Mexico? And he said,
yes.
all right, Johnny, thanks.
All right, sir.
Thanks as always. And again, if you're interested or just want to ask him some questions about Mexico or Costa Rica or your dental implants, travelcostaricanow.com, scroll down. It's a very quick form, and it will be to him ASAP. I'm Michael Allen, travelcostaricanow.com. That's Johnny. Hey guys, things are going to pop up.
Peace.
If you're thinking about living or traveling anywhere or doing medical dental tourism anywhere, always do your homework and research. And
Always.
if it's Costa Rica, well, Mexico in this case, I would say our videos. I would say go to our videos.
Every time, twice on Sunday.
That's right. Ciao.